And then lastly, the aspect of nutrition. This does come back to the American diet that's dominant in carbohydrates. If we keep taking in carbohydrates, we wind up getting an overabundance of sugar. The sugar winds up sticking to different parts of our cells, and then we get sticky or black. And we have to put other foods in a more balanced way to undo the stickiness. We think of the aspects of putting in more fats and more proteins to balance out our carbohydrates, but there's more to it than that. When we get under stress, we tend to go to sugar, not only emotionally, but physically. Our body tends to break down muscle tissue to turn it into sugar. When we sit, we tend to get more inflammation. The inflammation will lead to these problems in regards to choosing carbohydrates more often. So movement plays a role in this too. When we get sleep deprived, we tend to choose carbohydrates more often. So oftentimes we'll just sort of go to nutrition, but I want you to continue to think about those 5 foundational factors, choosing all of them, because those 5 imbalances are related to those 5 foundational factors. So lots of times when we are taking care of patients, we just tend to want to get to the answer. We want to get to the diagnosis. We want to get to the ICD-10 codes. But the problem is that is about 75,000 different options. You get to stay within 5. I don't know about you, but I like managing 5 more than 75,000. And it's with this 5 that you can reach people from a physical, a mental, spiritual point of view. Patients love this because you connect with them as a human being, as a healer, the way you were designed to be. So I really would like to challenge you to learn more about this functional medicine model. And I've given you a relatively easy way to at least get started on this. 5 factors in regards to behavioral modification: sleep, movement, food, stress management, community.